Hello, I'm Dr. Gert at Medical Aesthetics in New England here in Acton, Massachusetts. I would like to show you why we combine Vaser and Smartlipo here at Medical Aesthetics of New England to provide you with superior body sculpting results. After extensive evaluation of various body sculpting techniques, I found that combining Vaser and Smartlipo give the best overall results for both fat removal and skin tightening, with far less risk and downtime than with traditional liposuction. Let me show you why I've pioneered the combination of Vaser and Smartlipo here in New England, and why Medical Aesthetics in New England is the most popular and successful center in the Northeast to provide you with a superior service.
I'd like to explain exactly how combining Smartlipo and Vaser works. There are 4 major steps to this procedure. This is a picture of normal tissue with a top layer of skin, the underlying fat that we'll be removing, and the deep muscle layer. It is very important to understand that we don't do anything below the muscle layer. Below the muscle is where the intestines, kidneys, liver, and other organs are, and none of this procedure is done below the muscle. Also in the fatty layer is fibrous connective tissue that holds the skin in place, as well as nerves, blood vessels, and other important structures. One of the strengths of this technique is that these important structures are damaged much less than with traditional liposuction, so there is less bleeding, bruising, and there is much shorter recovery time. The first major step is to numb up your skin and fatty layer. This is done by using a very dilute solution of lidocaine and saline along with epinephrine. The lidocaine makes the fat numb so that the rest of the procedure causes very little discomfort. The adrenaline is important because it shrinks the blood vessels in the area so there is less trauma, bleeding, and bruising, and it makes the lidocaine numbing last longer. In addition, the fluid expands the fatty layer, separating the fat, and this makes it easier for the Vaser and the Smartlipo to melt the fat cells. The second step that I do is to use a Vaser to melt your fat cells. The Vaser specifically targets fat cells to liquefy them with minimal effect on nerves, blood vessels, and connective tissue. This is the Vaser's strength. The Vaser also tightens up skin, but I'll focus more on that in the third step with the Smartlipo laser. The Vaser is so effective in melting fat that we often see the liquefied fat looking like melted butter coming out in less than a minute. This shows how powerful and effective the Vaser is for destroying fat. In the third step, I use a Smartlipo laser right under your skin to stimulate the collagen layer and tighten it up. The Smartlipo is very effective as a finesse technique to tighten up skin from stretch marks, where the fat was removed from this procedure, and sometimes to smooth out surgical scars. While the Vaser ultrasound and the Smartlipo laser both melt fat and tighten skin, I use a combination to maximize each of their strengths. The Vaser is particularly effective for melting of bulk fat, and the Smartlipo is superior for controlled tightening of skin. The last step is to remove your melted fat. Because I'm removing melted fat and not large globules as in traditional liposuction, the suction is more gentle and the probes to remove the fat can be smaller. This allows for smoother looking skin afterwards than sometimes happens with traditional liposuction, and it is a lot less traumatic. There is less bruising and bleeding than with traditional liposuction, and the recovery time is often 1 to 2 days, not weeks. Before the procedure, I go over the consent in detail, answering any questions you might have. I then mark you for the procedure. We previously went over what areas you would like to have me work on, but this is our chance to get the details figured out. Marking is very important since the fat hangs very differently standing versus lying down. These markings will be my guide during the fat removal. After I finish marking you, I'll take more photos. All of our photos are standardized, and we never Photoshop the pictures that we use. To minimize any chance of infection, we have the patient take antibiotics for 5 days, and we also have them clean themselves several times at home with an antiseptic that we give them. Here we use the antiseptic as well, and we reapply it a number of times during the procedure. I begin the procedure by numbing the area being worked on. I use a dilute solution of lidocaine along with epinephrine. The epinephrine is important to shrink blood vessels, making this a less traumatic procedure. This means less bleeding, bruising, soreness, and a faster recovery time.
This is a Vaser probe. It's a solid probe with a blunt tip that pushes between the connective tissue strands, targeting the fat cells. It does not rip and cut. The rings in the end concentrate and transmit the ultrasonic energy, and so the energy is transmitted through the handpiece with it concentrated right here, melting the fat. So it goes into these little plastic silicone ports just to protect the skin, and it just goes back and forth, very smooth,
It's not a rough procedure, and sometimes there's a little bit of catch as it hits a piece of fibrous tissue. And that's what melts the fat. In the second major part of the procedure, the Vaser probe is placed through silicone ports to protect the skin. Then I move it gently back and forth to melt the fat. The patient will hear a high-pitched sound that is not unpleasant, but on the outside all we hear is a buzzing noise. Notice that this is not a brute force technique like with traditional liposuction. It is quite gentle and there is less trauma to the tissue. The patient usually doesn't feel any discomfort at all. This is a Smartlipo handpiece that I use in the third step of the procedure. It guides a special fiber optic cable to direct the laser light right out to the tip. The laser light is present only at the tip of the fiber, so all of the energy can easily be directed to where it is needed. So this is really just a guiding cannula here with the laser energy coming out of here. And I use the same incisions for all of these steps. So use the same incision here. And you can hear a beep. That's just the Smartlipo firing the laser inside. Can't really see anything right now, but in a couple of minutes I'll turn off the light and then we'll see what it looks like inside with the light off. What this is doing is, again, melting fat just like the Vaser, but this is really a finesse technique to tighten up the skin by building up the collagen right underneath the skin. So I'm really concentrating most of the laser energy right up underneath the skin, and that can help with stretch marks, or sometimes if there's a surgical scar, if I can get under it, it'll help to smooth that out. You can see how the Smartlipo moves easily back and forth under the skin, following the paths paved by the Vaser. I particularly use a Smartlipo right under the skin as a finesse technique. This melts the fat, but importantly tightens the skin by gently stimulating collagen growth. With the light off in the room, you can see the laser light under the skin. The patient often snoozes during this part of the procedure since it is painless, and they are wearing laser protective goggles, as am I. The last one of the 4 major steps is to take out the melted fat. I use a special low suction cannula made by the Vaser company. It is designed to gently remove the melted fat by moving the cannula back and forth, massaging the skin to get the melted fat toward the probe. As you can see here, it is very smooth, very gentle procedure following the markings I originally made when we first began. I concentrate in areas with the most fat, feathering out towards the edges. This is usually not an uncomfortable part of the procedure, although sometimes at the end people can feel a bit achy. At the end of the procedure, one of the benefits of this versus traditional liposuction where people are really heavily sedated is that they stand up afterwards. And what I'm doing here is I'm just looking to see if there's any asymmetry, and I found just a little bit above the belly button and then a little bit up in here, and I'm going to have her lay down again for 30 seconds, 60 seconds, just take a little bit more of the fat right out of that area, and then she's completely done, and then we'll put the garment on. This is the last step after we get you cleaned off, and we help you put on the garment. There's some pads here, and it's a very tight compression garment, specially made for this procedure. And then once this is all set, then you're good to go. We do this with the patient standing, and then afterwards, if the patient feels okay, we send them home. I've tried to show you why I feel that combining Smartlipo and Vaser provides the best possible combination of results, comfort, safety, and rapid recovery for you. If you would like to find out more, please call us at 978-263-1406 or contact us at medicalaestheticsne.com. As always, our consultations are free. Thank you very much.